This is for my HIIM 484 class. My professor for this past semester is Ashley Simmons. And for our capstone, we had to come up with a research question within healthcare. And I stuck around the realm of the healthcare opportunities within struggling communities. I did this because I think as a native of West Virginia, we have a lot of rural areas, and our citizens may not be equally served as some places around the country. So I think it's important to dive deeper into this and see why. So from viewing this PowerPoint and watching this presentation, I hope that you can understand the geographical effects within healthcare. Obviously, where you live plays a big role into healthcare. Facilities can be far away, so it's important that everybody can have access to quality healthcare. You should be able to define rural communities, where they are, what they're like, and why they're behind economically and geographically. You should be able to explain different types of healthcare available in underserved populations. Obviously, some people that live in New York City may have a lot more resources than someone who lives in West Virginia. You should be able to help create awareness around these situations. If we don't combat the problem, as soon as possible and try to fix it, it's probably only going to get worse. And then also, we need to be able to understand how change can take place in these towns. It's going to take a lot of people. It's going to take a village, so to speak. So it's important that we can get on that right away. So as I mentioned earlier, we had to come up with a research question. The first part was a paper. The second part is this presentation. My research question was, how does telemedicine and non-traditional healthcare delivery models improve access to quality healthcare services in underserved communities? I think this is really important, and I wanted to kind of dive deeper into this because I think this problem is only going to get worse. So I wanted to start with rural communities because some people may just not be familiar with rural communities. If they're from a big city, they may not think about it as much. So rural communities are often found in countrysides located miles away from urban and metropolitan areas. So in West Virginia, if you drive 20 minutes north, 20 minutes south, you're probably going to end up in a rural community. So it's important for us to understand what these people have available and what they don't. So according to the 2010 U.S. Census, rural populations make up about 20% of our country's population. As I mentioned earlier, there's a few big cities in our country, a few bigger states. They don't necessarily worry about this problem, but places like where we live, it's something we have to think about. This next stat I thought was really interesting. I kind of wanted to go forward in the research. Approximately 2/3, or about 64%, of West Virginia residents live in rural areas. I thought that was a really interesting fact because it just shows how almost behind West Virginians are. And I think that we are definitely behind the 8 ball when it comes to that. But it's nothing we can do about it. So, and then also rural areas may look different depending on what part of the country you live in. When you think of rural areas, West Virginia obviously has a ton of those. So what's rural here may look a lot different than maybe say New York City. So there's a lot of different reasons why rural communities struggle. So in a rural setting, there's not much opportunity for individuals for a variety of reasons. One reason, or the following reasons, are probably because there's fewer job opportunities. In these rural places, not a lot of businesses are attracted to going there because there's just not a lot of income coming in and coming out. Two is a limited population. There's generally the same type of people in these rural communities, so they kind of limit themselves and there's no room for growth necessarily. The third one is education advancements. People in these rural communities aren't able to get out and probably learn as much as a normal person, especially this focuses on lower health literacy. They just may not be as informed as a normal person, and that can hurt an individual in a number of ways because they may not know what a disease looks like or symptoms of an early disease or how to prevent that. The farming and agriculture inconsistencies. A lot of people in these rural communities, they feel that they rely on farming and agriculture a ton. So while relying on that, if, say, crops aren't growing or this isn't growing, people aren't going to want their crops, so they're not going to be able to produce and make money. And then number 5 is the lack of networking and diversity. For example, if someone's in a big city, they're going to know a ton of different people, and in life, networking is obviously super important. So not knowing these different types of people and not being able to put yourself out there in different situations because you're stuck in a rural community may hurt the individuals as well and the community. So within these rural areas, as I mentioned, the demographics are pretty similar. In general, rural communities are made up of Caucasian white people. In 2018, according to the U.S. Department of Agriculture and Economic Research Service, white people accounted for about 78% of rural population. Also, rural populations are anchored by an older demographic because younger people relocate to areas with higher returns of investment. I know me, as a younger person who's about to start a professional career, I'm probably not attracted to going somewhere within a rural population just because there's no room for growth necessarily. I know I want to be involved somewhere that I can meet a lot of different people, so then I have a lot of different options going forward. Or as a rural community, I almost feel like a lot of people that live there currently or from there. So there's not a ton giving back to the rural community, which is understandable. And then rural area community members are also more likely to be Republican. I found that online. I think that was pretty standard and pretty expected. So this graphic here was pretty interesting. I found it online. It says 7 out of 10 states have a larger percentage of rural population than the national average. So this just gives a graphic of the whole United States, and the map shows the percentage of residents in each state living in rural areas or urban clusters of between 2,500 and 50,000 people. So just looking at this map at a quick glance, the dark green is more than 50% of rural states. Of course, West Virginia is up there. It's kind of to be expected, but you have some of the other states up here near Wyoming, that's also kind of expected. So places like that, rely on each other. They may not have the same access and resources that some of these bigger states might have, like New York or Florida or Texas or California. So I think it's important for us to understand who's suffering and who's not. And also just as a standard, the people in these big states kind of take their access for granted. So the healthcare access in these rural settings is obviously not great. These countryside places, they suffer in a variety of ways, and healthcare is just another way that they're kind of behind. And it's not fair to them because everybody should be served the same type of care, but they just simply don't have the access for it. So healthcare is a necessity for every individual in America. Every citizen should be entitled to receive the best available care without restrictions. Unfortunately, an individual's geographic location can put a hold on this. It's just one of those things that it stinks for them, but it is what it is. They chose to live in these places. Medical organizations oftentimes position their facilities in high populated areas to increase their patient flow and help the largest number of people possible. Because of this, individuals who live in rural areas are put in a tough position. Obviously, when I think of this statement, I think of UPMC in Pittsburgh. Their facility is located right downtown. It's a huge skyscraper. I can only imagine the number of patients they treat a day and the number of lives that they're able to save and impact. So facilities like that, being in a metropolitan area, just allows them to see so many more people. And also, in a facility like that, you have to think of the number of providers that they employ. While employing these providers, the city of Pittsburgh is an attractive location, and people want to live there. So the location effects of these communities, for starters, quality care is hard to find in the healthcare industry, especially when it is located near you. Oftentimes, healthcare facilities can be difficult to access because of location, and individuals who are coming from rural areas may also have to deal with poor road conditions and infrastructure, which adds another layer of difficulty to receive care. For example, I know people who are battling cancer or a specific type of disease, or they have a diagnosis they can't figure out. A small urgent care or a small healthcare facility is probably not going to be able to help them as much as they would like to. So people who may live in these rural communities are forced to drive to UPMC in Pittsburgh or Ruby Memorial, and that can be a challenge because if it's an elderly person especially, or just a sick person in general, they have to find someone to take them to the appointment, they have to find someone to wait there with them, they have to find a ride back. And unless you're lucky enough to have a family member or someone that can do that, this oftentimes puts people in a tough position. More location effects. Another way that people struggle is that public transportation is not generally available to people who live in these small populated areas, so they must find their own ride to the desired location. As I mentioned before, some of these places can be 30, 40, 50 miles away from the healthcare facilities, so it's not just a quick hop on the city bus, or it's not just a quick Uber ride maybe there. It's an all-day event. So getting help for these people can sometimes be very difficult. Plus, also, the healthcare facilities have so many other people to take care of that it's just hard to worry about one specific person. So quality of care is obviously a big thing in healthcare. You want to receive the best care you can, and the facilities want to provide you with the best care possible, because it's a win-win in that situation. So in these rural areas, resources and technology is limited, so providers are not attracted to practicing there. According to a study produced in 2017, the federal government predicted a shortage of over 20,000 primary care physicians in rural areas by 2025. I know we are currently in 2025. Obviously, this was produced in 2017, so I would like to see the numbers behind that now that we're currently in 2025. But some of the reasons for this may be contributed to the lack of specialists, so providers have to treat a wide variety of diagnoses. I think that was really interesting because at big facilities like Ruby Memorial, they're able to have specialists in each subcategory to treat certain diagnoses. So you don't just have a primary doctor and trying to treat a bunch of specialty cases. They have specialty employees that are experts in that field to be able to help the patient. Also, the skill of providers is needed to be high in small areas because it's proven that rural citizens are more prone to chronic illnesses. I think that's also interesting because rural citizens probably aren't maintaining the healthiest lifestyle. As we mentioned, their health literacy, as stated before, is kind of low, so they may not know the best options for their health. They may not understand that a healthy diet is very key to sustaining a long, healthy life. So these people are more prone to these illnesses, which can lead to further complications in their life. So this was just an example I wanted to pull up. As a native of West Virginia, I've traveled and been to all parts of the state. And Franklin, West Virginia, it's in Pendleton County. That's where Seneca Rocks is, if you're familiar with that. It's kind of out in the middle of nowhere. As you're driving there, you go through windy roads, and it's kind of one of those places that, where am I at? So when doing research, I kind of think of places like this in West Virginia, and I think about the people that live there, because healthcare for them may also be an issue. So the population there is 456 people. It's 456 people, and the median age there is 55 years old. Again, there's not many young people, moving there, so the median age is only going to rise and rise. And after doing some research, it's located here on the West Virginia border, and there's not much around where they are in West Virginia. So the closest hospital facility that I could find was Centara RMH Medical Center, and it was 34 miles away from Franklin, West Virginia. And at these locations, it's not just a straight shot on the interstate. Excuse me. There's windy roads. There's obstacles to get there. So when you think of 34 miles, it may not sound that bad, but it's probably about roughly an hour on those roads, and that may be me being generous. It may be longer than that. So a place like this, and people that live there are just automatically stacked behind the 8 ball when it comes to receiving proper care, because they're so far away. Now, this was the closest hospital facility I could find. I'm sure, or I would like to think, there's probably some urgent cares around there, but again, an urgent care is only going to be able to treat the common cold, flu, maybe a small scrape on the arm. It's not going to be able to probably treat everything that you need. So talking about this, the big thing is, what's the answer for these people? Traditional care is great. Obviously, it's probably the preferred method, just because you can have a live interaction with somebody, but there has to be an answer for these people, because everybody deserves the same quality of care, so there has to be a way for them to receive that. So telemedicine is an awesome way for people to experience great quality of care. Telemedicine is a service provided to patients that allows them to receive professional care without having to be present in person, face-to-face. Telemedicine has been on the rise because of technological advances that have been made within the past 10 years. Technology has shot up almost in every aspect of life, and it's been that way, and it's just continuing to rise, which is an awesome thing for us. And the highlighting factor of this service is the convenience it provides to the population. So in telemedicine, you can click one button from your home and almost instantly receive care. So this video provides a closer look into telemedicine and what it is and how it operates. So that video just gave a little breakdown of telemedicine and who it applies to and how you can access it. So when using telehealth or telemedicine, they're really the same thing. They both provide care virtually over devices. So telehealth, telemedicine, same thing. When using these methods, professionals can provide the following services. They can record measurements. They can have an overview of your patient portal, which is kind of like your MyChart. I'm pretty sure everyone is familiar with MyChart by now. It offers face-to-face communication with the provider. It allows information exchange between providers. So if you're seeing one provider here for a certain service, another provider that you may see later in the week is going to have the same information and know how you're being treated for different diagnoses. And telehealth services also are affected by wearable devices and mobile health apps. Some of these devices can be an Apple Watch, a Fitbit. I think now a lot of people are wearing Whoop bands and the Oura rings that go on your finger. I don't know if anybody has those, but those are great ways to monitor your health and different vitals. So the rise of telemedicine. Telemedicine's been around since about the 1900s to early forms of technology, but it wasn't really until the mid-2000s when it became prominent in healthcare. The advancements of the technology also played a big role in telemedicine and allowed easier use for patients. One main reason, and this is definitely true, that telemedicine became so prominent was because of COVID-19. COVID-19 obviously put the world in an unseen time, and people did not want to get around each other to infect one another. So telemedicine kind of was the only form of care that was possible. Patients were allowed to explain their symptoms over the phone, and this would not allow face-to-face contact, so the provider would stay safe, the patient wouldn't have to spread their germs and diagnosis to somebody else. So this was an awesome way to start receiving care. And then alternative methods of healthcare were definitely needed, obviously, for people, especially in the rural communities. There had to be an answer for a way for them to get quality care. So this chart here, I think, is kind of proof of what the last slide is. So it's a new normal. The vast majority of hospitals that continue to use telehealth. So this is just showing the percentage of hospitals offering telehealth services from 2018 to 2022. So in this chart, you can see in 2018 and 2019, there was a small rise. I think that was just as technology started to really make its rise. But then you can see from 2019 to 2020, there was another big rise. That was the biggest rise in the past 5 years. And 2020, of course, is when COVID took form. So I think that obviously is the reason for the rise in the percentage of that. It was just a great way for the patients to stay out of the way and receive care, but also not infect the rest of the population. And also COVID, just no one really knew what to do in a way. So this was kind of a form of quality care while staying out of the way. So in telehealth and these services, there's different forms you can partake in. There's live video conferencing, almost like a FaceTime. If you were FaceTiming somebody, it's the same thing, just like a video call. The most popular feature is live video conferencing because it allows for face-to-face interaction through a mobile device. And this can take place on a computer, phone, or tablet. It's easier and the best method to communicate, and interactions can be as simple as checkups or as in-depth as future treatment plans. There's really no limitation to this. Providers will tell you what you need to hear in order to get you the best care. Remote patient monitoring, I mentioned this earlier, that would be something like your Whoop band or your Oura ring or a Fitbit. They use digital monitors to track patients' health. It's a continuous type of care that takes place over long periods of time. Providers may tell you to get a device like this so you can track your blood pressure over time, or you can track your heart rate over time, or the number of steps you're getting. So that allows you to kind of stay on top of your health so it doesn't decline. Vitals like heart rate, blood pressure are involved in this. And different devices that fall under this would be activity trackers, as I mentioned, blood pressure monitors, and glucometers. So all those are very important in maintaining your health. The benefits for patients using telemedicine, especially in the rural communities, it's improved accessibility to patients who live in underserved communities. Patients can monitor their health better from home and on their own time, which ultimately will lead to less health problems for the overall population. The wait times are reduced so conditions and diagnoses can be healed sooner, and patients do not need to alter daily routine because appointments can take place whenever and wherever. I think that's a big one because people, obviously if you work a 9 to 5, you're going to have to call off work either in the morning or in the afternoon or maybe the whole day to go see a medical provider. So with telehealth, you can probably take a call maybe on your lunch break or somewhere in the day. It probably will only last about 10 minutes. So I think that's a big key as to why people are starting to use it more and more. Telehealth also provides benefits for the providers. So for them, they're impacted less by no-shows when visits are scheduled virtually. There's no-shows and a provider's waiting for somebody. That not only takes out a chunk of their day where they could have been helping somebody else, but it also just may throw off a schedule. It's just not good for overall business. The ability to see and treat patients whenever they like, allowing for more flexible schedules and lifestyle. Some telehealth services, a lot of them actually are 24/7, so you can see a provider almost whenever you want. So providers are able to treat whenever they want. They don't have to go into an office. They don't have to make arrangements. They can kind of base their schedule around when they want to work, which allows for more flexible lifestyle. And providers can use smaller facility spaces because they will not treat patients on site. Again, this obviously saves them money because they don't have to pay rent for a building, or they may own the building, but there's less expenses involved because they can treat you from possibly the comfort of their own home too. So facility space is limited and not needed as much. There are challenges to telehealth though. It's strongly encouraged for community or rural community members, but you can have difficulties. Internet and Wi-Fi can be a big problem because in these places the bandwidth and connection usually isn't great, so you do need Wi-Fi for these calls. Most technology devices obviously rely on Wi-Fi, so if they're not operating to a good standard, it's probably not going to be a successful call. And then since individuals in these locations are more likely to suffer from poverty, the technology needed to participate in telemedicine services may be hard to obtain. Some people, as we talked about earlier, in rural communities may not be as fortunate economically. So tablets and computers and phones may be expensive to these individuals. So getting these devices may be hard. There's some more challenges. Since telemedicine is ran directly through technology, privacy concerns will be an issue. Data security issues may occur because technology and private information can be hacked into through public internet. As we've all seen, there's always data hacks going on, different types of breaches, so it's always something to look out for. Patients may be hesitant to share necessary health experiences and information because of safety concerns in virtual settings. I know the younger population probably wouldn't worry about this as much because they seem to put themselves out there a lot more, but the older population who didn't come up with technology and social media may be more hesitant just because they're not as familiar with the type of form this is through. So that is all for my presentation. These are my references that were used throughout the presentation. And then these are my references for the different figures that I use in graphics, the maps I used in the video. So that is the end of it. Thank you.